This is the Lone Crater YouTube. We hope this video helps.
You start now. Prioritize safety and stabilizing your head and body to avoid falls. Once seated, perform a quick symptom checklist. Clarify onset, one eye or both, presence of pain or flashes. Make sure to record the exact time symptoms began and any recent trauma or medication changes. If you experience sudden severe loss, flashes, or pain, call emergency services immediately. Otherwise, prepare to document vision changes and arrange urgent evaluation with an eye professional within 24 hours. Next, you run targeted checks and gather evidence for clinicians. Cover one eye then the other to isolate which side is affected, and test peripheral vision by moving a finger from the side at about 30 cm. Once done, optimize stimuli, reduce glare, increase contrast, and use 1.5 to 2x magnification for reading so you can function while awaiting care. Make sure to arrange an urgent telehealth visit or same-day optometrist/ophthalmologist appointment. Document any medications, blood sugar. Finally, you implement the clinician's treatment plan and begin rehabilitative steps. Start prescribed eye drops or systemic medications exactly as directed, normalize blood sugar and blood pressure if relevant, and schedule imaging or surgical consults when recommended. Once stable, introduce vision therapy exercises, prism lenses, and low vision aids to recover function progressively. Keep a daily log of improvements. If symptoms worsen, new flashes, expanding blind spots, sudden pain, or declining acuity, stop delays and go back to emergency care for reevaluation immediately.
Thanks for watching. Consider subscribing if we helped you.